Hello and welcome. My name is Sheila Samuels and I'm one of the non-executive directors here at Liverpool University Hospitals NHS Trust, otherwise known as LUFT. So thank you for joining our public members virtual event today, which is on sexual health matters, which will be presented by Phoebe and Alison from Access within the Trust. But before handing over to them to deliver the session, I'd just like to tell you a little bit about my role as a non-executive director and also touch on the importance of membership within the Trust. So I, along with my other 6 NED colleagues, we sit on the Trust board and together with executive director colleagues, we're responsible for running the Trust, collectively responsible for everything that happens there. But unlike executive colleagues who are full-time, non-executive directors are part-time and we're not involved in the day-to-day operation and running of the Trust, but we still remain jointly accountable for everything that happens. So our role is really to put challenge and scrutiny into the board and hold the executive directors to account for delivery of patient care, the strategy, the values within the Trust. So we're appointed individually because of our own backgrounds. So my background, for example, is HR, OD, governance, and this brings additional experience and support to the Trust. Most of us have served in NHS or larger organisations in our day jobs before joining as a non-executive director. So as well as to challenging, we provide constructive support to the executive team. So we also take on broader roles. So I am personally the wellbeing guardian for the Trust. So I ask those difficult questions around wellbeing within the board. What are we doing there? I'm also going to be what they call a senior independent director from October. And apart from other roles in being available if people want to challenge issues within the board, would be responsible for appraising the chairman on behalf of the governors. So we're appointed by the governors, the board of governors, and non-exec directors are held to account by the governing body, and this is carried out at each of the governors' meetings. As you probably know, the governors are appointed from the membership, and membership, being a member of a public membership or a staff member, is really important to us within the Trust because this provides us with the link to the wider sort of population, to those people who we either employ or are service users. And we like to keep the membership informed so we can take views on how we're doing, be told of issues that are happening that we don't know about, and to shape our strategy and development. So your membership, your involvement is really key, and this is just another session where we like to keep you informed of things that are happening within the Trust and services. So without further ado, I'll now hand you over to Alison and Phoebe to present to you what I hope will be a very interesting and informative session. Thank you.
So, hello, my name is Alison, this is Phoebe, my colleague. We're 2 doctors who work in the Access service in Liverpool, and today we're going to tell you a little bit about what the service does and why sexual health matters for everybody. Okay, so who are we as a service? We are a free, confidential sexual health service. We are based in Liverpool, and that's what we're going to mainly talk about today, the services that we have to offer here. So we're part of the NHS, so everything about accessing us is free. Also, all the treatments we give out are free. We don't have to pay prescriptions for the things that we offer. We have a completely different system from the GPs in the hospital. We give people separate identity numbers so that nothing that you talk about with us gets linked to any of your other health records. We've got 3 clinics within Liverpool. We've got Access at the Royal, we've got the Beat, which is in the city centre, and we've got a South Liverpool centre in Garston as well. But Access also covers quite a lot of the northwest, as you can see there, Knowsley, Cheshire, Warrington and Halton as well. So, who makes up our team? We are quite a wide range of different people working in Access. We've got everyone from the secretaries and the reception team trying to make our patients feel as comfortable as possible when they book into us and need to get some help, to the healthcare assistants and the practitioners who work in the clinics, to give you screening, see you when you have a problem, and do our best to get you treatment. And we also do a lot of work in research to make sure that everything we offer you is the most up-to-date that it can possibly be. So there's a nice little list and a nice little picture, so you can have an idea about the sorts of people that you'll be seeing if you come to us. So why are we here? When most people think about sexual health, the first thing that comes to mind is sexually transmitted infections. So I think most people could probably name a few, and we're here to help people with those problems. Now, sexually transmitted infections can affect different groups of people more than others. We know that a lot of young people experience high rates of sexually transmitted infections, but we also know that it affects other groups more than we would expect, like people who have gay and bisexual relationships, people in more deprived areas, Black and minority ethnic populations. And it's our job to make sure that everyone feels like they can access our services and get help, and not feel stigmatized, not feel like they can't come and get help from us. So why are we here? We know that syphilis and gonorrhea are quite big problems that people might not realise are out there in the community as much as they are. And as I said before, they affect gay and bisexual men in particular, and also ethnic minority populations for various reasons. So we're working to create special clinics to make sure that everyone feels like they can come to us and get treatment for this, so that we can try and avoid things like this spreading and keep people as healthy as possible. So sexual health is really important, and Liverpool experiences lots of sexual health problems. In 2019, nearly 6,000 new sexually transmitted infections were diagnosed in Liverpool alone. And if you look at this nice little map, we're in quite a dark red colour, which shows that that's more than we would expect for the national average. We actually pick up quite a lot of new HIV cases in this region, and we know that from the research we've done, lots of people pick up their diagnosis late in the northwest, which means that we need to work really hard to make sure people feel able to come and get tested for these infections, because there's lots that we can do to treat them and help people. So sexually transmitted infections aren't just in and of themselves a problem. They can lead to lots of other issues for people, like they can affect people's mental health. People feel very anxious around things when they're worried about sex. Infections can go on to lead to other problems, like making you more at risk of certain cancers, reducing your fertility, and in some cases, like with syphilis, you might then go on to have problems with births and babies being infected. We can do so much to prevent any of those problems if we come and get tested and get the treatment that you need. So we're here for everybody. Okay, there's no one who I think we can't do something to help out. Whether it's coming in for a routine checkup of your sexual health, we offer routine screens for chlamydia, gonorrhea, syphilis and HIV without even needing to see a practitioner. We can give you treatment and advice if you have an emergency situation that you just need some help for. And we can give you education and information about how to make safe sex choices. Different speciality clinics, because as I mentioned before, one of the main things that I think stops people coming to get help is anxiety around coming to talk to people about sex, because it can be quite a loaded subject for some people and people might not feel very safe talking about it. So we have clinics like the Butterfly Clinic. So that's moving to the beat, and it's a special clinic for transsexual and non-binary people who may have felt judged or like they weren't given a good service when they've sought sexual health help before, and it's just for them to have a full sexual health service, and they can get access to screening, vaccinations, PrEP, which we'll talk a little bit about later on. And they can be found at the Beat, and you can email in if you want to have an appointment with them. We've got appointments specifically for young people, and we've got a young people's clinic for under 19s. That's just a walk-in, so people can turn up at the Beat when that's in session at any point and just get some help. And we also have our own specialist HIV clinics here. So we're a regional specialist centre, and we've got various clinics for HIV in the region. And anyone suffering from HIV can get in contact, find a service which they feel suits them, and be seen there for their regular care. Now, another thing we do as a specialist service is lots of people have specific worries about sex. They might not feel comfortable with it for one reason or another. They may feel like their libido is too high, they want too much sex, they feel like they don't want enough sex. You might feel like how you feel isn't normal, but often more people than we realise have those kind of thoughts, and sometimes it's helpful to speak about those to professionals. So we have a psychosexual clinic which we and your GP can refer you into to talk to someone if you've got concerns about sex, or you feel like you're not able to experience everything you want to because of those fears.
So often people don't know what we necessarily cover in a sexual health clinic apart from STI screening. So in the middle you can see here our core services, so things like screening and diagnosis and treatment. We also think about how to prevent sexually transmitted infections with education. We notify partners or help to support partners, patients to notify partners. We do a lot of sexual health promotion, teaching, training, and then also research, like Alison mentioned. Also, on top of that, we have our specialist services. So we have genital dermatology clinics where we can have biopsies taken and different treatments done there, which are more specialist. So you can be referred by your GP or come to the gum clinic and we can refer you directly there. We have good links with Liverpool Women's Hospital and Alderhay for our HIV and syphilis maternity care to make sure we get the best outcomes. We review patients on the wards as well in the hospital for those that have sexual health needs there. We have links with RASA, which is sexual abuse services. So when you come to see us, we can support you with that. We have expertise in male chronic pelvic pain. We have the ability to offer patients that are penicillin allergic the potential to try the penicillin to see if we can delabel that allergy in cases where we don't have many other options. And we also work with BASH and BEVA, who are the like sexual health and HIV associations, and we work with them, for example, with the monkeypox outbreak to make sure that we're following guidelines and updating them with our data from our clinic. So as mentioned before, what can we do? STI screening is a very big thing, part of what we do. So we offer free screening and free treatment for everybody. So thinking about the common symptoms that we often see in the clinic, so that can sometimes be new or different discharge, discomfort when having a wee, ulcers or lumps down below, pain when having sex, maybe pain in the testicles, abdominal pain, and some people don't have any symptoms at all. Common STIs that we often see, which you may have heard about before: chlamydia, gonorrhea, syphilis, genital warts, and herpes. And then we also look at other problems which aren't sexually transmitted, so things like thrush, bacterial vaginosis, urinary tract infections, like skin dermatitis, which can often mimic STIs and be similar to that. Another big part of what the services do across Liverpool is contraception. This is a big focus at the Beat. For emergency contraception, which is often needed soon after unprotected sex. So we offer that in the form of emergency pills, and then also copper coils as well, which can be fitted. So that's something that you can attend the clinic urgently for, and we can discuss options that suit your situation. We offer condoms for all patients as well. There's the option of contraceptive pills, and again, depending on people's medical history, there's different types that suit them. We also offer some medium-term reversible contraceptives, so that's things like the contraceptive injection, contraceptive patch. And also some people choose to go for a more long-acting contraceptive device, so things like copper coils, marina coils, or contraceptive implants. At the moment, we've got a sort of advertisement going to try and encourage students to take up long-acting reversible contraceptives to make sure that they're having safe sex and trying to prevent unwanted pregnancies. But this is something that we discuss with lots of people in the clinic dependent on their history. We also have emergencies that we like to see as soon as possible in our clinic. One of those is sexual assault. We can offer help and support for those that maybe want to report it to the police or access forensic testing. We don't offer those directly at our service, but we can signpost them to where to go. We can help them access support networks to manage what's happened. And then we can also offer screening for them for sexually transmitted infections, emergency medications they may need, such as emergency contraception, and then also vaccinations for things like Hep B, and then I'll also link that into PEP. So PEP is post-exposure prophylaxis, and this is for people that are concerned that they may have been exposed to HIV in the last 72 hours. In this case, we encourage people to come see us as soon as possible because that is most likely to be effective in that the sooner you come. This is something that also can be started in A&E as well if it's out of hours, and then not often come to see us afterwards to discuss that further. So this is a short course of medication for about 28 days to help to reduce the risk of being infected with HIV after an event. We're here to keep people safe in sort of preventing issues down the line. So here we have PrEP. So that's pre-exposure prophylaxis. So PEP was post-exposure prophylaxis, so that's after. So this is what we try to give before having sex for those that are increased risk of having getting HIV. So that may be our population of gay and bisexual men or people that have HIV positive partners. This is free from our clinic, so everyone can come and have a chat to us and see if that's suitable for them and if that fits them, and we can discuss that. We also offer vaccinations as well, again, to prevent any issues down the line for people. So we offer hepatitis A and B, the HPV vaccine, and more recently we started doing the monkeypox vaccine. And again, these are on an individual basis and for certain people that are at risk. So how can you access us? As of a couple of weeks ago, we've just restarted our walk-in service. So this is available on our website for you to find out about the times, but it's at the moment it's offered on every Monday, Tuesday, Wednesday and Friday from 9 till 12 in the morning. And so if you have a look online, you can find out a little bit more about that. And then apart from that, we also offer the ability to book appointments, which we've just started doing online, and then we also have that via the phone. If coming to see us maybe doesn't suit you or isn't the most appropriate, there's also a chance to order free home testing from our website. And again, you can have a look on there and we can let you know whether that's suitable for you. And in emergencies, we'll always try our best to fit in people if they need to be seen. But we have to do this on a case-by-case basis. So that's the end of our presentation. I hope that it's been informative. Please let us know if you have any questions and we'll try our best to answer that for you.
Okay, so we're just going to have a look at what questions have come in now. There's quite a few. We'll try and get through as many as possible, but we might have to reply to some by email. So, how old do I have to be to access your service is one question. So our young person's clinic covers under 19s, and correct me if I'm wrong, but it's normally 13 to 19-year-olds. Yeah, 13 to 19 is the general ages which we cover in our clinic, but we welcome anyone under 19 who needs to come to our young people's clinic, and they can be signposted to anywhere else that they may need to go to. Second question is access confidential? The answer is yes. Everything that you say to us is confidential. We use different systems to the rest of the hospital and the GP, and we don't use your normal identity numbers, so that anything that is recorded here can't be linked back to any of your other health paperwork or records.
So should I be worried about monkeypox? Obviously, I think a lot of people are aware about monkeypox now. It's something we're definitely aware of because a lot of the cases of monkeypox are found in sexual health clinics in general because of the symptoms and the signs that people see. At the moment, we're, like I said, we're vaccinating patients that we feel are at higher risk, but I think that's having, overall, the vaccination is having a good effect. Like with any infection that's going around, it's good to be aware of it, and if you're concerned that you may be at risk or you maybe got some signs and symptoms of it, then it's always best to either contact us if it's related to us or your GP or services like that. But I think at the moment there's lots going on in our clinic to try and help people with monkeypox and help prevent it, which I think has been really positive.
Yeah, just to say that generally people we're vaccinating against it would be men who have sex with other men, or people who are having large amounts of sex. So you'd be more at risk, say, if you're a commercial sex worker, we want to get you vaccinated, but we're not seeing much of it in other populations, and generally speaking, most of the cases haven't been too severe. So another question is, I'm considering starting on contraception, but I'm worried about side effects. Which contraception would you advise has the least associated side effects? So contraception, there's so many contraceptives available that it's difficult to give general advice about it because different things work better for different people. We've got a lot of information on our website about all of the different types and the different side effects that they come with. Some people prefer to use non-hormonal contraception, so that would be the copper coil or condoms, because they don't come with the same side effects that come with hormones. But as I say, everything we do comes with a few side effects. So it might be best to, you can either come in and talk to us and we can go through what would work best for you, or you can have a look at our website, and we've got lots of information about all the different types, and it can help you to decide what you'd like to talk about a bit more.
So our next question is, with some STIs you don't always get symptoms, does that mean I should get checked out just in case? Yes, the short answer to that is what we think here at the Sexual Health Clinic. There can be infections that you have that you don't necessarily know about. So if you're having sex, we always recommend to have screening often before a new partner and then after your new partners, because it's important to just make sure that you're not carrying any infections that you don't know about that might later down the line cause some issues for you. When you come here, we have the option for patients that don't have symptoms, we do screening, and also patients with symptoms, we do screening, but we sometimes do a few extra tests for those with symptoms. So yes, we definitely recommend getting tested if you're sexually active.
Okay. And then is there still a lot of stigma around talking about sexual health? So sexual health can be something which people find more difficult to talk about because it's not something that we're used to talking about often. Here we do it all day long, all day, every day. So there's no stigma in talking to us about your sexual health, and we really encourage people to talk to any of your healthcare providers you need to about your sexual health, because it's an important part of who you are and it's an important part of keeping healthy. So I think as time has come on, it's become much less stigmatized to talk about it, because we know that it's just another part of your routine healthcare that we need to sort out for you.
And then the next question is there any male contraceptives in the pipeline? So at the moment, that's not something that we offer. But from what I have seen sort of in personal research or on the news and things like that, I can see that things are underway. But obviously with any new medication that we start, we have to go through trials, and that can often take a long time to get that approved. So as far as I'm aware, I think things are moving in the background. So like you say, I think there's potential, but at the moment I'm not aware of anything that's been approved or is ready to go yet.
Indeed, it'd mainly be saying to use condoms, and there's also the option of vasectomies. That's all we have at the moment for the men. I think the final question we've got is, do you receive more inquiries from females than males about sexual health? I don't have any specific data about this to give you, but anecdotally I would say no, not from what I see in the clinic. Would you say?
I'd say it's equal. We get
pretty equal, and that's how we like it. So everyone is welcome to come to us, and we'd really encourage anybody to come and have a look at what our service has to offer you, because I think we've got something for everybody. Right, I think that's the end of the questions. So thank you all for coming. It's been a pleasure to talk to you, and we hope that we can help you all out in the future.